Okay. Good morning, afternoon, and evening to everyone joining us. Please drop us a message in the chat box to let us know when you are connecting from. And a very warm welcome to all our panelists and guest speakers. We are very grateful to have you join us today. For those who don't know me, my name is Eddie Rudram. I am the Communications and Advocacy Manager at Y+ Global, and I'm currently based in Bangkok, Thailand. I'm also the moderator for the launch of this Advocacy Toolkit, which was co-developed by regional and global networks of young people living with and affected by HIV. This was all in response to the commitments of the political declaration in 2021. And I think we've been working on it for quite some time now. I'm very pleased and proud to get this out there into the world. But before we begin, I do need to mention that we have enabled closed captioning. So if you need help with speech to text, you can enable this on your devices. And also please use the chat box throughout this webinar because we do want to hear from you. So let's begin without further ado. I would like to invite His Excellency Mitch Fifield, Permanent Representative to Australia at the United Nations in New York, and one of the co-facilitators of the 2021 high-level meeting on HIV/AIDS, to share some opening remarks. Can you hear us okay?
Great. Good to see you, Eddie. Good morning. Good morning, everyone. Fabulous to be with you. And can I, at the outset, really thank UNAIDS for inviting me to speak today, and thank all of you for taking the time to join in this important occasion. And can I also say how fabulous it is to see Jana. One of the great joys of co-facilitating the political declaration was the opportunity to meet Jana and spend time with Jana. So good to see you. And can I also congratulate all of those who are involved in developing the youth-led advocacy toolkit for the 2021 political declaration. As Eddie mentioned, Australia co-facilitated the 2021 political declaration with Namibia, with my good colleague Neville. And I got to say, we're just so thankful for efforts such as this to support the accountability for commitments made in the declaration, because the declaration really is only as good as its implementation, and it's only as good as it makes a difference in the lives of people. So thank you so much for what you've done. And something that we know, I guess, which we hold to be a self-evident truth, but we still have to keep repeating it, is that when communities are proactively involved in ensuring their own well-being, then success is more likely. And that's why Australia worked in close partnership with civil society and other stakeholders during the 2021 political declaration negotiations, because we really wanted to ensure that the declaration reflected realities on the ground, that it made concrete commitments that we could use to hold governments to account to address HIV/AIDS. And we're proud of the commitments in the declaration, and I think it's worth just quickly going through what those commitments are, because they are important. And they do include to end inequalities and discriminatory laws, policies and practices, to work toward zero stigma and discrimination for people at risk of, affected by and living with HIV, to reduce gender-based inequalities and sexual and gender-based violence, and to bring 95 testing, treatment and suppression targets for all groups, and to fully fund the AIDS response, including $29 billion annually to low and middle income countries. Now, the toolkit that we're launching today is a timely reminder that continued efforts are needed at all levels, right down through the grassroots, to meet the commitments of the political declaration. Also, we won't succeed without meaningful engagement of youth in our national HIV responses. And the data, I've got to say, is compelling. And we thank UNAIDS and others for continuing to shed the spotlight on the need to meet the needs of young people. Young people living with HIV need equal access to antiretroviral therapy and other HIV services, and we need to bridge the knowledge gap about HIV. UNAIDS 2022 Global AIDS report noted that in sub-Saharan Africa, for example, only 37.6% of youth aged 15 to 24 years had comprehensive knowledge about HIV. So a big chunk of people don't have the knowledge that they need. And lack of knowledge about HIV is also hindering the response in Australia's neighbourhood, particularly in the Pacific. And we know that these knowledge gaps extend to sexually transmitted infections, contraception, and other aspects of sexual and reproductive health. We must keep the issues and the needs of young people, key populations, at the top of the advocacy agenda. The realities of young people in all their diversity need to inform our response. And Australia's partnership with UNAIDS and other international organisations is key to ensuring the voice of young people and civil society more broadly is brought to bear on critical decisions, including in the HIV response. Also, Australia supports a range of non-government and community-based organisations that work to ensure that youth can engage in policy, legislative and other decision-making debates and discussions on issues that affect their future and well-being, which is as it should be. Friends, let me close these opening remarks by noting that the Australian government is committed to accelerating efforts to ending HIV transmission in Australia and providing quality of life for people affected by HIV. This includes the establishment of an HIV task force that will drive Australia's HIV response and implementation of our national HIV strategy. The 9th HIV strategy for 2023 to 2030 is currently being drafted and will set the goal for the virtual elimination of HIV by 2030. And it is expected to be released later this year, so keep an eye out for that. Colleagues, thank you so much for the opportunity to talk with you this morning, to share. And just on a personal note, can I say that being the co-facilitator for the HIV/AIDS political declaration and for the High Level Week is one of the most meaningful and important things that I have done in my public life as a senator, as a cabinet member, and now as UN ambassador. I just wanted to indicate to you just how important that task was and just what it means to me to have had the opportunity to help shape that. So great to be with you, and back to you, Eddie.
Thank you, Ambassador Fifield, for your opening remarks and for all your support. And I couldn't agree with you more on your statements. When communities are involved, we see successes, and that is very, very relevant to young people, because when we participate meaningfully throughout program design and to the implementation, we see improved health outcomes. So that is extremely relevant. Thank you so much again for your time and for joining us. I would now like to pass the mic to Suki Beavers, Director of the Equality and Rights for All Global Practice at UNAIDS, to share a few words. I know you had to step in at the very last minute. So again, we also appreciate your timely support. Thank you for joining us. The floor is yours.
Thank you very much, Eddie. It's really my pleasure to be here. And I send regards and apologies from Christine Steglig, the UNAIDS Deputy Executive Director, who is ill today and unable to be with you, but her misfortune is my luck. It's always such a pleasure to be on a panel like this one. Ambassador Fifield, always such a hard act to follow, but please let me add my thanks to you for all of your leadership and contribution to the response, which has truly been remarkable. Thank you. And thank you to all the networks that have invited me to join this event. And thanks also to Yana and Agnes and Molly and Anthony, Lagi and Ruby, and all the speakers and participants with us today. At the 2021 UN General Assembly high-level meeting on HIV/AIDS, member states recognized that the issues facing young people in the context of the HIV response and committed to addressing these barriers in the ensuing political declaration. which also highlights the importance of involving young people in decision-making and holding their governments and all governments accountable for their commitments. Young people continue to play a crucial and a leading role in the HIV response. You continue to tirelessly advocate for changing the world for the better and ensuring that no one is left behind. You have a strong commitment to creating a society where everyone is enabled, empowered, and free to enjoy their rights. We also recognize that this is not something that you can or should be doing alone. So UNAIDS will continue to support your work and will continue to encourage other stakeholders to increase their support to youth-led organizations. Accountability is important as it shines a light on how effective our work is or isn't for communities in all their diversity and at all levels, including the grassroots level. As young people with your ear to the ground and through your lived experience, you are an invaluable part of the global AIDS response and in holding all of us accountable for delivering on the commitments to end AIDS as a public health threat by 2030, including for young people and young key populations in particular. We all have roles to play and that we must be accountable for. UNAIDS has many roles to play, including to generate and share data, knowledge, and evidence to support the implementation of the global AIDS response, as well as supporting advocacy, and through our convening role, bringing diverse stakeholders together. As youth networks participating in the design, implementation, and monitoring of policies, processes, and programmatic interventions, you are critical to ensuring the needs and the rights of young people are being fully addressed in the AIDS response. You also have a key role to play in calling the rest of us out when we get things wrong. And this is a role that we know you play so well, and we thank you for it. Unfortunately, though, all around the world, we still have a lot of work to do because for too many young people, the right to participate has not yet become a reality. And the fight continues to try to have this right realized, to demand accountability from duty bearers and ensure the HIV response is led by and serving young people in all their diversity. There is much more to be done to get the AIDS response back on track. This is where the Global AIDS Strategy comes in with its strong commitments to increasing the proportion of HIV services delivered by the very communities most affected by and vulnerable to HIV. We can now rely on the 30, 80, 60 targets to call for and in fact insist on increased service delivery by youth-led organizations, which we know is so important for youth and for young key populations in particular. These targets commit all of us to ensuring that by 2025, 30% of testing and treatment services, 80% of prevention services for populations at high risk of HIV infection, including for women within those populations, and 60% of programs to support the achievement of the societal enablers should all be delivered by community-led organizations. And importantly, this includes youth-led organizations. I want to recognize and thank all the youth networks here today for your leadership, participation, and the unique contributions you make. In addition to assessing the extent to which young people are involved in decision-making processes, your networks are also heavily involved in service delivery, advocacy, and monitoring to help improve the availability and accessibility of HIV prevention and treatment services, particularly for young people in all of your diversity. I'm really honored to be part of this event today and take this opportunity to reconfirm that UNAIDS remains committed to supporting youth-led organizations and youth-led responses. Let me close by congratulating everyone involved in the publication of this toolkit, which not only presents important advocacy guidance, it's also a really excellent example of how good young people's networks are at working together for the benefit of your communities. Thank you again for the vital role all of you play in holding all stakeholders accountable for the achievement of the targets, including for young people. Thank you.
Thank you, Suki. It was really encouraging to see your commitments and the support that both UNAIDS and Australia play in supporting youth-led networks and organizations. We hope that you can stick around a little bit longer to hear directly from young people on the importance of meaningful engagement in these spaces and why we should all be supporting youth-led advocacy. So we also have another special guest, someone you might recognize from 2 years ago. Yana, hi. You spoke at the 2021 high-level meeting on HIV/AIDS, and you still remain a key voice in promoting youth leadership and meaningful youth engagement in the HIV response. It's so great to see you again. Could you share with us some of your views on why your engagement at the high-level meeting was so important and why it is important for us to commit to the SDGs and the political declaration?
Thank you so much, Eddie, for this question, and to Y+. Also, happy to see Minch and Suki and other leaders, young leaders. So, hi everyone, my name is Yana Panfilova. I was born with HIV and I'm from Ukraine. So in 2021, it was my honor to speak at HLM with so much hope for the future of young people and bold new commitments to end AIDS. But today, almost 2 years later, we are way off track and we are under attack. For the last 15 months, Ukraine has been attacked by Russia and big part of Ukraine are still under Russian occupation. Almost every night, Russia launched dozens of missiles and drones against my family, my friends, in my home in Kiev. Now I live in Berlin, not as a tourist, but as a refugee. But every night I'm afraid to fall asleep because I don't know how thousands of Ukrainian young people will survive this attack and how we will recover from the mental scares of living as refugees. Ukraine is now diagnosing 21% more new HIV cases than last year, because when the people are under rocket attack or must defend their homeland, access to condom and PrEP are not your top priority. People living with HIV in occupied Donetsk are now forced to get a Russian passport in exchange for access to HIV antiretrovirus therapy. There are violations of the health and human rights, and the international system is powerless to demand justice. When this HLM political declaration was agreed, it was the first time in the history of the UN this declaration was adopted by a vote called by Russia. The writing was on the wall, led by Russian authoritarian countries were more interested in promoting family values than ending AIDS. That is why the role of young people and civil society is so important in the all UN fora, because we refuse to be silent in this fora by these countries. But it is in these same countries that young people and civil society, especially young people living with HIV and young key populations, are under the greatest attack. I'm a founder of Teenagizer, the last youth network for adolescent and young people in Eastern Europe, Central Asia. I hope other young people never experience the toxic cocktail of anxiety, risk, and isolation that young people in Ukraine are facing today. Homesickness, loss of relatives, rape, post-traumatic stress disorders, and other mental health issues, sexual and gender-based violence. I have never been one to give up, but this war has given me a lesson in solidarity with other young people and key young population in Afghanistan, Sudan, and today, especially in Uganda. Every day, young people with HIV are still dying, not only from the virus, but from the fears and stigma and the anxiety created by discriminations. In too many countries, it feels safer to hide in the shadows with HIV, or even being gay or being a migrant, that it's come forward to ask for help when you fears and you are going to be treated as the second-class citizen. We spent years fighting so that young people living with HIV could have our health and rights protected, but now it feels like our gains are disappearing every day. Even during this war, we have continued to provide online peer psychological counseling for more than 20,000 young people, especially adolescents. I'm proud of my work and proud of our work, but we can only support a small number of young people who need help now. In all our countries, who is going to support the millions of young people we still can't even reach? Let us remember what was bold and unique in the political declaration. For the first time, member states committed to JIPA and young people to play their critical leadership roles in the HIV response. So my key message today, and to every group I speak today to, we are not going to give up. We are not going away, and we are going to link up with other youth movements for health, climate, and social justice, but never take our focus off of HIV. We are not going to accept the status quo, because the status quo is killing us. We are not going to stop until the commitment to the leadership role of young people becomes a reality. Thank you so much.
Thank you so much, Yana, for joining us and for sharing your story. Can't imagine everything that you've gone through in the past 15 months, but your story is one of bravery and courage. And I think a lot of people are rallying behind you in solidarity. And it's exactly what you said. We're not giving up, and we're building a movement here, and we're never going to lose focus of the commitments that we've made within HIV and AIDS, right? So thank you again for being here and for sharing your story. And I sincerely hope that you're doing okay. Fantastic. Okay, so now I would like to dive into the actual toolkit itself. Let me just share you my screen. I have to multitask here. So this is why we're here. Can someone just confirm they can see my screen? Because I can't see.
Yeah, I can see it, Eddie. Thanks.
Fantastic. So this is why we're here. It's been 2 years in the making. So I know that some of you may have already seen the Advocacy Toolkit. We have shared this between the partners, between the networks that were involved, and we've disseminated it across our platforms. So this is just an example of what we did for Y+ Global. So we began working on this toolkit long before the high-level meeting started, because we recognized how important it was for youth-led networks to remain engaged in the high-level meeting, but to also keep building on the momentum long after, and to ensure that youth issues remain at the forefront. So the Advocacy Toolkit was designed by and for youth-led organizations in order to support them to utilize the political declaration for their advocacy and to hold national AIDS responses accountable for their commitments. So on the screen here, this is an example of what we have done for our website. On the page, you can see that we broke up the toolkit into what we called individual modules. This is supposed to show how we have tackled different subjects around the political declaration and what youth-led networks can focus on in their advocacy. So as you can see here, we have issues like CSE, disabilities, harm reduction, human rights, etc. So it's important to mention here that when we developed these models, we relied on the expertise and the knowledge of each of the networks that brought to the table. So for example, Youth Rise, being the global network of young people who use drugs, they played a major role in developing the harm reduction module, and Youth Voices Count being the same for LGBTQ rights. But all in all, this was a collaborative process, and we all had a say in how the toolkit was formed. So I'm just going to click on one. I'll do harm reduction since it's already here. So as you can see on this document, we have created a baseline. We provided a background and a baseline, which are the commitments raised in the political declaration. These are the minimum commitments that member states should be aiming for. So in the modules, we provide background, the commitments, and then also we broke down the language, because we know that sometimes the language in the political declaration is really confusing, and sometimes I didn't even understand the language. So we wanted to make sure that we created something that young people could use in their advocacy and that was easy to understand. So on the right-hand side here, you should be able to see what we have provided for and a breakdown on what youth-led organizations should be advocating for. So we always recommend that when you advocate with the government or with other people, that it's always directed towards, rights affirming services, laws and policies, and to use the political declaration as some form of leverage. At the end of the day, this is what countries committed to, right? So let's make them accountable. So some of the topics here that we covered in the toolkit they focus on intersectional issues where they overlap with commitments on certain issues like CSE, LGBTQ rights, and SRHR. Now, some of these issues didn't come up strongly in the high-level meeting, and there were pushback, but this doesn't stop us from advocating for these issues. Where there is a will, there is a way. We can always use this guide in our advocacy. And if we're struggling to bring up certain issues, we could always find links between other health issues or any other issues that countries have committed to. So even though that CSC, LGBTQ rights might have not come up strongly, we can still use this guide as a way to uphold these commitments. Now, I don't have time to break down all the individual modules, but I do recommend people joining us today to visit not only Y+'s website, but also the other networks. I can post this in the chat box. If someone can post this in the chat box, that'd be great. But we can also share this with all the participants afterwards, so everybody has a link to the toolkit. So before I pass on the mic to the next speaker, one second. I just wanted to say, oh, sorry, my screen is, stop sharing. Okay. I just wanted to give a big shout out first to Gareth. Gareth, you've been sitting behind the scenes, but a big shout out to you because we couldn't have done this without your support, yours and Alicia's support. You've been there from the very get-go for the past 2 years. And I think I speak on behalf of all the youth-led networks that we're incredibly proud of the work that you have done and for bringing us all together, because again, we really couldn't have done this without you. So bravo to you. Okay. So next we have conversations with networks. So before we actually jump into the next speaker, I do want to hear from the people who are joining us on Zoom. Please let us know in the chat box what you think your country needs to do to meet these commitments in the 2021 political declaration. Let us know your thoughts on meaningful engagement and what type of advocacy you're involved in, and let's try to get this conversation going. So in the meantime, we'll jump to the next speaker. We have Legi. Legi, are you there? I can't see.
I'm there. Yeah.
Oh, I see you. Hi, how are you?
Hi, Eddie.
So, Legi, you are the project officer at Youth Lead and the lead person of the Count Me In Youth Consortium under the Global Fund Community Rights and Gender Strategic Initiative Grant. Wow, that is a mouthful. You primarily work to advocate for young key affected populations, aiming to ensure we all have a presence in decision-making spaces. Thank you so much for joining us. Could you briefly talk to us or share your thoughts about how Youth Lead has been involved with national networks in your advocacy, post-HLM, and how youth-led networks should use this toolkit in their advocacy?
Absolutely, Eddie. Thank you so much. So good morning, good afternoon, and good evening, everybody. It's my honor to present the regional networks at the launch event of the Advocacy Toolkit developed jointly by a coalition. And my name is Legi, and I work for Youth Lead, and the Youth Lead works to create an inclusive region where the human rights of young key populations are well respected and the impact of HIV/AIDS is mitigated through the meaningful involvement of young key populations to equal and equitable access to HIV prevention, treatment, care, and support. In the beginning, I would like to emphasize the importance of meaningful youth engagement. and youth leadership in the HIV response. We see as it should be inclusive, intentional, mutually respectful partnership between advocates, youth, and adults, whereby power is shared, perspectives, contributions are valued, and young people's ideas, perspectives, skills, and strength are integrated into the design and delivery of the program strategies, policies, funding mechanisms, and organizations that affect their lives and their communities, countries, and the world. So let me go through the few data. So according to the latest update from the AIDS Info, 15 out of 18 countries in the region have incorporated youth intervention into their national strategic plan. And this development seems very promising and positive. However, we still should question the extent to which we generally involve or engage in the actual process. And according to our latest situation analysis about youth engagement in the CCM, the Global Fund process in the region, it shows very interesting finding. As we're aware, the Global Fund serves as the largest donor for HIV programs. In each country, the Global Fund established a decision-making body known as CCM, right? And surprisingly, out of 14 CCMs in the region, only 7 of them have the youth representatives, despite the fact that the remaining countries have youth-specific priorities and interventions outlined in their national strategic plan. This situation raises concerns as the CCMs make decisions and approve work plans for youths without adequately considering or including voices of young people. And it tackles a commitment in the 2021 political declaration about ensuring that young people are adequately presented and included in any consultations, as well as in the decision-making spaces. Youth-led organizations and networks have always faced challenge in terms of data availability. And many funders and donors require extensive evidence to prioritize programs targeting youths, adolescents, and young people. Regional networks like Youth Lead, Y+, Youth Rise, we strive to produce and provide data, studies, and research, but it's never enough. Therefore, it's crucial for youth-led networks and organizations to be adequately resourced, both financially and technically, in order to support young people and organizations at the country level. Additionally, based on the feedback we have received from the youth leaders in the countries we serve, the non-enabling environment and structural gaps pose the biggest challenge. And these factors result in a lack of youth inclusion in the grant-making process, limited representation in the decision-making spaces, and insufficient youth empowerment, specifically in the CCM or National Strategic Plan, or the proposal of the development for the HIV response. Well, in conclusion, this toolkit stands out for its inclusivity and recognition of the essential needs of youth-led responses at the regional, global, and national levels. And it emphasized the crucial role of youth networks and organizations in mobilizing for advocacy and ensuring accountability towards fulfilling the commitments outlined in the declaration. And yeah, thank you so much for your attention.
Thank you so much, Lakey. You broke down quite a lot of important issues there. I mean, data A is extremely alarming, like Ambassador Fifield had mentioned in his opening remarks. But at the same time, we need to be looking at the meaningful engagement of young people in all these decision-making spaces. And I think the work that Youth Lead and Y+ is also doing to monitor the CCM is quite revolutionary because it's not been done anywhere else. So again, if anybody needs access to the CCM work, maybe Lakey, you can drop down the link in the chat box so that people can access it. Thank you again for joining us today. And I just want to flag a couple of comments in the chat box. Tara, I do apologize, I'm terrible at names. Tara, I think you mentioned it's time our governments and political leadership switch from declaration and commitments into action. I could not agree more. How do we translate words into action? Because year in and year out, these commitments and declarations are made, but no action. I think that's incredibly relevant, and I think we should put that on a t-shirt. Sustainable funding is crucial. I couldn't agree more. What we've seen so far is there is lack of funding going towards youth-led organizations, and we need to make sure that they're not only well-funded, but it's sustainable, right? Because they are leading the front and we need to be supporting them as well. So next, we're going to hear directly from representatives of youth networks to speak on certain themes and issues. First, we have Agnes. Agnes is the Associate Program Lead on HIV Self-Testing and PrEP at the African Network of Adolescent and Young Persons Development. Agnes, are you here? Can you hear me?
Hi, hello, Eddie. I can hear you.
Fantastic. So for adolescent girls and young women, so there have been many commitments, right, on gender inequalities. Many youth networks are doing incredible work on this. Can you tell us a little bit more about the role of adolescent girls and young women that are playing and driving governments to achieve these commitments?
Okay, thank you very much, Eddie. As you had already mentioned, my name is Agnes Dogara from ENIDE, based in Nigeria. So, it's a different thing to make a commitment, and it's an entirely different process to, achieve what has been stated in some of these commitments. Nigeria, for an example, has just experienced, change in government, which means the government that made this commitment, another government has come in. So, which means a lot of work needs to be done for us to be able to achieve some of these, commitments the previous government had made for this political declaration. Now, you see, gender inequality and gender-based violence has been sparking the HIV epidemic amongst the adolescent girls and young women in Africa. From data, it says that adolescent girls and young women they account for 25% of new infections, HIV new infections in Africa. That's a huge number. Now, so many commitments have been made, yes. And from adolescent and young persons angle, it definitely has to boil down to advocacy. And one of the ways of being able to achieve this advocacy now, firstly, social media has been an important tool in getting the attention of the government. So we've leveraged on some of the networks that we have as adolescent girls and young people. We're leveraging on some of the networks that we have to carry out quarterly advocacies to the government on social media, because Nigeria, for an example, the social media is an important tool if you want to get the attention of the government, if you want policies to be changed, if there are responsibilities or things you want the government to do, the social media is an important tool. So yes, we'll be leveraging on that. And then, we cannot entirely, aside the government, trying to achieve some of these commitments they've made, we also have roles to play. So we don't want to entirely rely on the government in achieving some of these commitments that have been made. From our own end, we'll also work with, youth network. We'll partner with youth networks, youth networks, young people living with HIV networks, adolescent girls and young women network. Some of the commitments they made on, the reason for the increase, the young boys also play in integral or important role in this HIV epidemic. So we'll also, from our own the youth networks that we have, we'll leverage on it to also sensitize some of those young boys on the roles they play in ending this gender inequality and the rise in the HIV epidemic from our own angle. And also the government have made commitments doing programs, designing programs that speaks to the data of adolescent girls and young women. Now, it's another different thing if they have specific data that speaks to the challenges or the experiences of those adolescent girls and young women, and then involving them in designing programs that affect them. Because it's just like, if you want to design a program that affects me, someone young like me has to be there in designing this program, because it is only that person that knows what it feels like. So now involving adolescent girls and young women in designing some of these programs that affects them, it's very, very important. So we'll also, part of our advocacy will be that a great work has been done, quite all right, but we need to push further with our advocacy. We'll be visiting some of the government agencies to advocate for, adolescents and young women being involved in designing some of these programs that directly affects them. Now, another thing, a commitment on stigma and discrimination was made. Stigma and discrimination has been a very vital issue. It has been there. The struggle has been there to end this stigma and discrimination. Now, in adolescent girls and young women, we have them in their diversities. We have adolescent girls and young women who use or inject drugs. We also have some who sell drugs, and then the sideline part of the adolescent girls and young women, that's those that are in humanitarian setting. That's an integral part of, it's another important part amongst these adolescent girls and young women, especially in Nigeria, because we've been having so many, crises that some of them had to, be taken to internally displaced persons camps. So this particular group of people have been sidelined. So when they are designing programs, for adolescent girls and young women, and then trying to stop the stigma and discrimination, it is important that they work with the entire adolescent girls and young women while designing some of these policies to stop the stigma and discrimination. And the funniest thing is, some of these people that do this, stigma and discrimination, even in the healthcare facilities, this stigma and discrimination happens. So our advocacy, part of our advocacy would be, asking the government to train some of this, to put policies in place, which is very important, and to make sure that they train people in these healthcare facilities now to stop stigmatizing and discriminating these adolescent girls and young women when they go to the facility to access some of these healthcare facilities. Healthcare services, because it is only when they feel they are safe to go to these healthcare facilities, that's when they'll go to these healthcare facilities to access some of these services. So our advocacy will be to the government. We use social media as an important tool. We have started, but more work needs to be done, especially now in Nigeria that, there's been a change of our government. And aside the advocacy around, putting policies to stop stigma and discrimination, to end these gender inequalities, and training training some of these healthcare service providers to end this stigma and discrimination. And also, we also partner with youth networks, because obviously we cannot do it alone. We have to do it together as a team. So we partner with some of these youth networks to push further these political declarations that have been made, so that it will be achieved, because it's different when commitments have been made, and it's an entirely different process for us to achieve or push these governments to do as they had stated in the commitment. So thank you very much, and Eddie, over.
Thank you so much, Agnes, for giving us an update on what your organization is doing. And there's 3 things I want to flag. Obviously, I'm biased. For social media can be such a powerful tool for youth-led organizations for their advocacy. And we need to have, I think youth-led organizations need to have a better understanding of how we can use this to expand our work and its reach, because I think it could do incredible things if we utilize the platform social media in a way that benefits our work. The other thing you mentioned was stigma and discrimination in healthcare settings, which is completely appropriate. The data shows that young people and young key populations are not accessing services because they're simply not youth-friendly. So we need to be able to be involved in the program design and making sure that there are youth-friendly services in every continent, so that young people are not scared, they're not going out to access services in fear, so that we can bring down those numbers. And also the last thing you brought up was intersectionality. And I think we need to incorporate that in every aspect of our work, because we need to reach those most marginalized. Thank you again, Agnes, for joining us today and sharing your thoughts on that. So the next speaker we have is Anthony. Anthony, hi. So Anthony.
Hi, Eddie.
Hi, how are you?
Good.
Anthony is the Deputy Executive Director of Youth Voices Count, a network of young LGBTQ people in Asia and the Pacific. They have been involved in advocacy and issues of HIV and gender equality for the past 15 years in the Philippines and regionally in Asia Pacific. Anthony, it's great to see you again. Please let us know why it's important for not just only young key populations, but young LGBTIQ plus people to be engaged in high-level discussions and processes, and what roles young people can play in decision-making process at the national level.
Thank you very much, Eddie. Hi, everybody. My name is Tony. I'm from Youth Voices Count. And LGBTQ plus young people should be involved in high-level processes because, one, we exist. Advocacy and development work, high-level processes, policy and decision-making all require evidence in order for stakeholders to take action. Now, if it's not in black and white, it does not exist. Meaning, if literature, engagement, and participation of LGBTQ plus young people in high-level processes is lacking or non-existent, it also implies that we do not exist in the lens of stakeholders, governments, and other gatekeepers, which takes away our human rights. We need to be ethically and meaningfully engaged in high-level policy and decision-making processes. This recognizes our unique needs, the gaps in high-level and national policies, and creates a space where young people for years on end have fought for in order for us to be heard and for some even be acknowledged for action to be taken and placed on the ground. It's also very important that LGBTQ plus young people are engaged in order for us to secure investments and policies which would provide resources to help mitigate the impacts of HIV and AIDS in our communities, among others. Now, we know that among all the populations, young people aged 15 to 24 years old account for more or less 26% of all new HIV cases in Asia and Pacific countries in 2021. And that number is still growing. Talking closer to home, the Philippines has the fastest rising HIV epidemic in the region, with new infections more than quadrupled since 2010, according to UNAIDS Asia Pacific. Now, involving young LGBTIQ plus people in a meaningful and ethical manner provides for an environment where governments and stakeholders genuinely recognize our roles in building a humane and just society where diversity, equality, and inclusion thrive. Giving us the space recognizes our rights and makes us part of the literature, which in turn translates to evidence, which then can be a basis and context for legislation in local and international contexts, specifically those that outlaw discrimination against us. Now, laws and programs cannot just be materialized without recognition of our existence and meaningful engagement. We can use a toolkit to develop young LGBTIQ plus people's capacity in doing advocacy work and lobbying for policies that would make a difference in the community. Now, looking at the toolkit itself, we see that it is segmented into different areas specific to the thematic areas that would be very beneficial in advocating for our rights. Now, we would need support in three aspects. First, meaningful and ethical engagement, including inclusion in key literatures. Young LGBTIQ plus people need to be engaged in order for us to be able to express our needs and the gaps in the responses or programs currently being implemented on the ground. Without us in the key documents, we are virtually non-existent. So the first step in order for you, the governments and stakeholders to be able to support us is to acknowledge us and give us the platform to express our agenda. Second one, we've heard this before, technical support. A lot of people say that young people don't, specifically LGBTIQ plus people, do not know anything. So our call is help us so that we can help you create more meaningful programs for key populations. Give us the technical knowledge, provide us with the skills we need, and let us lead because we know that we can. And the next item that we need support on is, of course, funding and other resources. On the ground organizations have very limited to no means at all or resources to mobilize. We need sufficient and sustainable resources in order for us to move and to uplift our communities. Now, although there have been a number of movements relying on the generosity of the private sector and even private individuals, they can only do so much. We cannot disregard the power of the resourcefulness of young people, however, but with your help in funding LGBTIQ+ organizations, we could cover more ground and spread information that we need as much in a much faster pace. Now, to end, let me reiterate the words that have been used over and over again in this advocacy. Nothing for us without us. Anything about us should also be with us, from us, and for us. And for young people out there, this reminder from a dear friend of mine: if you're not given a seat at the table, always be prepared to sit on the floor. Everybody, thank you very much for this time. Viva Youth Viva, Viva Youth Viva, Viva Youth Viva. Thank you very much and have a great day, everyone.
Thank you, Tony. I love that quote about if there's no seat at the table, sit on the floor. I think that's great. I couldn't help but reflect on all the comments that you have made and also think about where there have been so much pushback on LGBTIQ+ rights. I'm talking about Uganda, I'm talking about the States. We're seeing a rise in a lot of anti-LGBTIQ+ rhetoric. And, you know, we need to show that we stand in solidarity with our rainbow friends and making sure that we support our brothers and sisters in any way that we can, because this has just been a terrible year for our community in some of these countries. And that's not okay. That just sets back the HIV movement in a long way. And thank you, Tony, for joining us. I'm seeing a lot of comments. Viva Youth Visa. Yes, yes, yes. Okay, we have Ruby. Ruby, hi, how are you? So Ruby is a drug and policy reform and harm reduction activist with a background in grassroots youth activism. She's a skilled, experienced advocate from grassroots to high-level advocacy, and became involved in drug policy reform while doing her undergraduate degree in international development at the University of College Cork in Ireland. Ruby has been involved in youth rights since 2020 as the International Communications and Advocacy Officer, and became the Executive Director in May 2022. Ruby, are you here with us? I'm sorry.
Yes.
Oh, yes, you are. I can see you. I'm sorry, my screen.
No worries.
Yes, could you share with us a little bit about the development of the toolkit, how this was a joint effort between all the youth networks? I was wondering if you could touch upon the importance of collaboration and partnership on events like the high-level meeting, and why it's important for us to follow up on these commitments and make governments accountable.
Sure thing. I'll do my best.
Okay.
So thank you so much for this opportunity to share about using the 2021 political declaration for advocating for the health and human rights of young people who use drugs and young key populations. I actually gave an intervention in 2021 when this was released at a similar UNAIDS event, reflecting on the high-level meeting and the outcomes of the political declaration in regards to specifically mentions of young people who use drugs and harm reduction. And I shared how we hope to use the political declaration as a tool for advocacy. So it's great to be back at another event to share what we have been working on to advance these advocacy efforts. So Youth Rise is an international network of young people who use drugs across the world. We have staff and members in 27 countries across 5 continents, representing and bringing the nuanced needs of young people who use drugs in their countries to the forefront of policy debates, service improvement, and human rights conversations. And through our partnerships with youth-led organizations like Youth Lead, Y+ Global, YPeer, and our partnerships with the Harm Reduction Consortium and the creation of this toolkit, we've conducted advocacy through various activities that hold governments accountable to their commitments in the political declaration since it was adopted. To advance the meaningful engagement of communities within the HIV response, Commitment 64, we've developed the leadership and capacity of young people who use drugs through trainings and workshops and advocacy for policy reforms and inclusion of young people in service delivery. We've also conducted internship programs where we support young people who use drugs to work in spaces that have great political influence. We're also part of the Adolescent and Young Key Population Partnership, and we're part of creating the Adolescent Young Key Population Toolkit, as well as this incredible toolkit on the political declaration. alongside UNICEF, UNAIDS, and other youth-led organizations. We also conduct advocacy alongside other partners like SSDP International for the inclusion of young people who use drugs in spaces like the UNODC Youth Forum and other UN youth spaces to ensure our needs are reflected in statements that are made about us. Within these partnerships, we've also advocated for an enabling environment for harm reduction services for young people who use drugs through the reform of laws and policies, such as decriminalization of drug use and possession, and removal of age of consent laws for harm reduction services, Commitment 65A. We support young people who use drugs in communities across the globe to bring the results of the Global Drug Policy Index, a tool that's mentioned in the toolkit in the harm reduction section, to their national governments, highlighting the impact of their punitive policies on young people who use drugs, and collaborating worldwide during the Support Don't Punish campaign, which you may have heard of, and if you haven't, please check it out, calling for an end to criminalization of young people who use drugs. And to create an enabling environment for civil society participation in processes and procedures that affect young people who use drugs, Commitment 64C, we have worked with Youth Lead and Y+ Global to support projects in a variety of countries, ensuring the impact of COVID-19 on young people who use drugs is documented and heard at national platforms, and that young people who use drugs are informed and included in Global Fund country coordinating mechanisms, as Leggy was explaining earlier on. As a consortium of youth-led organizations, we have also advocated for sustainable financing of harm reduction services, pushing for involvement of young people who use drugs in CCM processes and working towards increased investments in harm reduction, and actively participating in global fund replenishment campaigns. To collect evidence on young people who use drugs, which we keep hearing is for young key populations in general, is severely lacking, especially also for young people who use drugs. And barriers to accessing harm reduction services and human rights violations, we have supported organizations in countries around the world to collect data from the community and brought this evidence to important international bodies, such as the Office of the High Commissioner on Human Rights. We've written papers on issues faced and needs of young women who use drugs and young sex workers who use drugs, bringing in that intersectional element, and supported young researchers to submit articles to academic journals as well, so that the evidence that we are collecting can also be used by others and maybe have a bit more credibility to it, because as young people, we often get slandered with that unfairly. We've advocated for meaningful engagement in services planning, monitoring and implementation, Commitment 65G, through interventions at regional and international bodies, bringing the documented needs of young people who use drugs to the Commission on Narcotic Drugs, for example, which is where we do a significant amount of our work, pushing governments to both understand and take action on young people who use drugs as key informants and essential to ending HIV/AIDS for our population. To improve access to justice and legal services for young people who use drugs, Commitments 65B and 65D, we've provided support to national organizations to document the human rights violations in their countries faced by young people who use drugs and increase their knowledge of the laws and policies in the country amongst the community. We also have conducted international, regional trainings on access to justice for this population and supported the documentation of legal services around the world through the further development of the TRIP app services map. So I want to thank you once again for this important event, and I hope we can take the learnings from each other's efforts to hold the governments accountable to further advance our fight to end HIV/AIDS for all. Thank you.
Thank you so much, Ruby. I think walking away from that, what was key was partnerships are critical. We can't do it alone, right? And you mentioned Support Don't Punish. When is that day? It's around this time of year, is it not?
Yes, 26th of June.
26th of June.
Yeah.
Everyone mark that in your calendars.
Yeah, yeah.
Thank you so much, Ruby, for joining us. And last but not least, we have Molly Chan, who's from Guatemala and is currently a member of the steering committee of the PACT, a global coalition of 150 youth-led and youth-serving organizations working on SRHR and HIV. Molly Chan supports the implementation of the Uproot scorecard at the country level. And the PACT has been working very closely with global, regional, and national youth networks on accountability. Molly, can you please give us an overview of the work with the PACT on accountability and how this also plays a critical role in achieving the targets set out in the political declaration?
Yes, thank you very much, Eddie, for this roundly introduction. And yes, of course, I'm so happy to talk about what we do. And yes, my name is Molly Chan, as you mentioned, and I'm the advocacy lead at the PACT. So right now, I want to talk about what we do and why we do more deeply. So We are a coalition of youth lead and young service organizations within the HIV and SRH movement. Our shared goal is to ensure the health, well-being, and human rights of all young people. Today, I want to talk to you about a project that holds immense significance for us, the Uproot Project. So the central vision of the Uproot Project was to create solidarity among young organizations working together strategically and collaboratively in HIV response. We recognize the need to tackle the root cause that put young people at risk, including discrimination, inequalities, violence, and exclusion. To achieve this, the project focused on 3 strategic areas. Firstly, we aim to challenge harmful legal and policy barriers that deter young people from accessing essential services. By advocating for change, we can ensure that young people have the supporting needs to protect their health and well-being. Secondly, we are committed to supporting and encouraging youth participation in the HIV response. We believe that young people have a unique perspective and should be actively involved in decision-making process that affect their lives. By empowering them, we can create more inclusive and effective response. Lastly, we seek to ensure innovative partnership between network of young people. Collaboration is key driving meaningful change. By working together, we can amplify our voice and achieve great impact. The methodology of Uproot Project is based on a scorecards process that actively involves young people in identifying challenges and making recommendations related in poverty reductions. It consists of several stages, including farming youth stems, collecting and analyzing data, identify challenge and recommendation, and presenting the results to relevant stakeholders. This methodology creates an inclusive and safe environment for young people and share their views without fears of stigma or discrimination. So far, the Uproot Project has been implemented in countries such as Madagascar, Nigeria, and Indonesia, but this year, with the support and of course, the alliance of Just Lead and Y+, we are proud to expand our reach in implementing the project in 8 countries, including Panama, Pakistan, Cameroon, Zambia, Kyrgyzstan, Vietnam, and Nigeria. So why this project is so significant for us? Because it goes beyond just enable young people to participate in advocating process and learn about their social political settings. It also teaches them address the challenge they face. We want to see more young people representing the diverse tapestry of society, actively involved on the ground and in decision-making spaces. Together, we can make a difference. By addressing the root cause, challenges barrier, promoting youth participation, or forgetting partnership, we can create a world where all young people can thrive. The Uproot Project is a testament to our commitment to build a better future. Let us continue to work together to ensure the health, well-being, and rights of every young person in all their diversity. Thank you.
Thank you so much, Molly, for joining us and for reflecting on the work that the Pact is doing. I think you demonstrated that there is a lot of collaboration going on between different projects. And as you mentioned, Uproot, we're launching the next round of Uproot scorecards in various countries. And I hope youth-led organizations keep an eye out for that. Thank you for joining us. So we're nearly towards the end now of this launch, of this webinar. Suki, are you still here with us? Just double checking.
Yes, I am.
Great. Do you have any final reflections on everything that you've just heard from our speakers today?
Well, thanks, Eddie, and thanks to all the speakers who shared with us their really valuable perspectives on the 2021 high-level meeting and how really critical it is that we all work together to achieve the commitments. I'm not going to try to summarize, the really excellent interventions, but maybe I'll just highlight a few things that really struck me from the various speakers. To start with, Jana's remarks really drove home both, I think, the importance of ensuring that we don't lose the gains that we've already made in the HIV response, and that we really need to continue to move forward but also the really important lessons of solidarity, especially in the most challenging of times. Ruby spoke also about the key role that young key populations, including people who use drugs, play in supporting each other and engaging in partnerships, and importantly about generating data on the achievement of the targets that were set out in the political declaration. Leggy, thank you for reminding us about the importance of integrating meaningful youth engagement principles to increase effectiveness of the response with and for young people. Tony, of course, raised the key issue of meaningfully and ethically engaging young people, in particular young LGBTQI+ people and other young key populations in national and regional and global HIV responses. And I love the excellent advice, if there's no seat at the table, sit on the floor. UNAIDS wholeheartedly supports all of these principles. Agnes, thank you really for bringing the focus on the importance of ensuring adolescent girls and young women in all their diversity are able to make decisions about how the response should serve, your needs and advance your rights. Molly, thanks. The focus on Uproot really helped highlight how collaboration between youth-led networks is critical to change. And I also really liked, although we didn't have a lot of time to delve into the toolkit itself, it's really clear that the organization into modules and the focus on ensuring that the language of the political declaration is accessible, and importantly, the application of the intersectional approach are really important features that will make the toolkit particularly useful, I think, for youth-led advocacy. And I guess maybe just, it's so clear that although we've made significant progress to address the needs of young people in the HIV response, there's still really a long way to go to ensure that the political declaration targets that are so relevant to young people are achieved. And we know to get back on track, we need the meaningful and active engagement and leadership of young people, especially those living with and affected by HIV. And that's in all stages of the response. And, I totally agree with the comment in the chat box that we have to go from rhetoric to action and really make those commitments mean something concrete. And, it was really great to hear directly from all the youth leaders on the concrete actions that you're already undertaking to make sure that decision makers are held accountable for their commitments, and articulating the support needed to make this happen. I'll just finish by saying UNAIDS will continue advocating for all of your recommendations and guidance to be put in practice and to intensify the efforts to end the AIDS epidemic. And thanks again for including me in this really great event today. Back to you, Eddie.
Thank you so much. And thank you for joining in at the very last minute. We're so happy to have you. And yes, everything that you said is completely right. What we do now is important. How we walk away from this and what we continue to do is important. And what we've already seen and what youth-led networks have already shared is that we're doing a lot. So we just need to keep up the good fight and make sure that we're doing it in partnership and collaboration, and also keeping UNAIDS involved as well, because you are the biggest supporters. And we really thank you for everything that you have done for us. And so just before I finish, just a reminder, the toolkit is available online. We will send out a link so that you have access to it again. I think we've already posted it in the chat box, but we'll make sure to send it out in an email again so everyone has a copy. And if you have any questions or any issues, any suggestions that you want to raise, you could always reach out to Gareth or I. Gareth, we'll send out emails right after this. I think we have the participants list.
Yeah, will do. I'll make sure everyone gets the links.
Fantastic. Okay. Thank you so much, everybody, for your time and for joining and for sharing your experiences and your stories. Super grateful to have a platform like this where we could actually meet up and listen to each other. I hope I'm not going over too much time. So yes, if it's the beginning of your day, have a lovely day. If it's 10 p.m. like myself. I'm going straight to bed. So thank you everybody for joining. Actually, the speakers, if you could stick around, we would love to take a photo before we quickly say goodbye to everyone else. But if you could just turn on your cameras. Actually, everyone can turn on their cameras. Anyone who's here in the call, we would love to see your faces. Yes, and we'll take a couple of screenshots so we can post this on our social media. Okay, I'm gonna need some help with this. 1 second. Chat. I'll just give it a couple of seconds. If anybody wants to turn on the cameras, you're more than welcome to, not just the speakers, but completely up to you. Okay, I think it's just the speakers, I think. Oh, we cannot, I'm so sorry. Oh, this is embarrassing. IT problem, it's okay. Can we? Oh
Sorry,
my God, yes,
we turned it off for security. Apologies.
Thank you. Fantastic. Thank you so much. Oh, that's so embarrassing. Oh my God, so many amazing faces. Okay, great. Okay, I'll do the screenshot. I'll say 3, 2, 1, 3, 2, 1, smile. Another one, 3, 2, 1, smile. Fantastic. Thank you so much, everyone, for joining. I hope you have a lovely day and the rest of the week. We'll stay in touch. Thank you.